Kia ora everyone, this is almost everything you'll need to know about the coronary circulation, the coronary arteries and coronary veins. Most people learning about this for anatomical purposes get very confused because they keep trying to use the clinical names for the vessels and they soon come unstuck. So most people, for example, identify this as a left anterior descending artery, and they can identify the circumflex, or left circumflex, which they sometimes call it. But then when they get around to the back of the heart here, things get very confusing, especially the name of this artery here, which is most often a branch of the right coronary artery, which is a lot longer than most people realize. So the way to go is to simplify the model and consider the heart as a four-chamber structure, like most people would draw it in two dimensions, children, or like you would see in a four-chamber view on an ultrasound. So in three dimensions, such a model would look like this. So here we have right atrium, left atrium, right ventricle, left ventricle. Sorry about my incredibly amateur camera work. The things that divide the chambers up are the sulci of the heart, and that's where the coronary vessels run within those sulci. Here we have a sulcus separating the atria from the ventricles. So this is the atrioventricular sulcus. Goes all the way around, as you can see. And here is the sulcus that separates the ventricles. So right and left ventricles. This is the interventricular sulcus, and it also goes all the way around. So we have an anterior part, which is the anterior interventricular sulcus, this, and the posterior part, which is the posterior interventricular sulcus. I've represented an interatrial sulcus here, but you don't really need that in terms of the coronary arteries. So it's a simplified three-dimensional four-chamber view of the heart, and we can begin to add the arteries to start with, and then we'll discuss the veins. So there are two main coronary arteries, the left and right coronary arteries. The left coronary artery soon divides into two branches. This leads clinicians to refer to the left coronary artery as the left main stem, because they like to describe things, but there's no inherent order in their description. The left coronary artery divides into a anterior interventricular branch, which runs in the anterior interventricular sulcus. This is the artery that clinicians refer to as the left anterior descending artery, or LAD. Anatomically, this implies that there's a right anterior descending artery and a left posterior descending artery, or a left anterior ascending artery. So it doesn't make any holistic sense, whereas anatomists call this the anterior interventricular artery, which implies that there's a posterior interventricular artery, which there is. Anyway, the left coronary artery and its large branch, the anterior interventricular artery, can be placed in the anterior interventricular groove, like so. And as you can see, this artery is perfectly sensibly named anterior interventricular artery. The other branch of the left coronary artery is the circumflex artery, circumflex meaning to travel around or circumnavigate, if you like. And this artery travels in the left part of the atrioventricular septum and circles around to the back of the heart. That's this guy here. So now we've shown both branches of the left coronary artery, the anterior interventricular artery, clinically the left anterior descending, and here the circumflex coronary artery, travelling in the atrioventricular groove on the left side all the way to the back of the heart. obviously the right coronary artery will travel in the right atrioventricular groove, or the right part of the atrioventricular groove, to fill in this space. And in most cases, the right coronary artery will continue down the posterior interventricular groove to become the posterior interventricular artery. And this means that the circulation is right dominant, because the right coronary artery supplies or becomes the posterior interventricular artery, and that defines dominance of the coronary circulation. Occasionally, the circumflex branch of the left coronary artery will project down into the posterior interventricular septum, and in that case the coronary circulation is said to be left dominant. But that doesn't occur very frequently. It's much more common for the right coronary artery to continue down and form the posterior interventricular artery, and that's the definition of coronary dominance. So we'll add, So I'll add the very long right coronary artery, into its appropriate sulci. So returning here, we see now the left coronary arteries, the two branches, joined by the right coronary artery, travelling on the right side of the atrioventricular groove around to the back of the heart, to that area called the crux, and then changing course to travel down the posterior interventricular septum, and confirming that the coronary circulation in this case is right dominant. So it's a very long course for the right coronary artery. The left coronary artery gets a lot of the attention, especially the left anterior descending, horrible clinical name, especially the anterior interventricular artery, because it's the one that causes the most trouble. It has to supply the left ventricle here, and the left ventricle does all the work, so it's more dependent on steady oxygen and nutrient supply, more dependent on its artery, which is the anterior interventricular artery. Branches of the anterior interventricular and posterior interventricular artery sort of anastomose down here towards the apex of the heart. And sometimes the posterior interventricular artery has a very long course, especially the part that supplies the left ventricle, can become compromised, and this would be an inferior cardiac ischemia or an inferior myocardial infarction. And so that involves usually this branch of the right coronary artery, or this continuation of the right coronary artery. And that's also why inferior infarction is often accompanied by posterior infarction, because it's the posterior interventricular artery, and also inferior infarction known to cause problems with both right ventricular activity, because it's from the right coronary artery, and also predisposes to arrhythmias, because the right coronary artery also supplies the right atrium, and that's where the pacemaker cells of the heart generally reside, the SA node particularly, and the right coronary artery also very commonly supplies the AB node. So problems with the right coronary artery causing inferior infarction associated with posterior ischemia and right ventricular ischemia, and also arrhythmias. There's an anatomical reason behind that clinical issue. So we can now strip away our very nice coronary arteries and consider the coronary veins, or cardiac veins as they are known, and this is where most anatomy students come unstuck. The veins travel in the same sulci, so the same route as the arteries, but they're named differently. So there is a great cardiac vein, which is very long, though we should point out that length has very little to do with greatness. Middle cardiac vein, which is less long, and a small cardiac vein, which is very short. The great cardiac vein travels in the opposite direction initially than the anterior interventricular artery. So it starts at the apex of the heart and travels up the anterior interventricular groove towards where the left coronary artery has divided, and then it travels in the atrioventricular groove around to the back of the heart. And here near the crux of the heart, it becomes very enlarged and forms the coronary sinus, a large vein. So here we've added in our great cardiac vein, initially travelling in the anterior interventricular septum, then turning into the atrioventricular septum, where it follows the course of the circumflex coronary artery, or circumflex branch of the left coronary artery, to the back of the heart, and then forming this larger coronary sinus. Anatomists are fond of pointing out that as it travels in the groove, atrioventricular groove, with the circumflex coronary artery, this is the only place where in the human body where a vein and its accompanying artery, or an artery and its accompanying vein, have blood within them that's moving in the same direction. So here, in the anterior interventricular groove, the anterior interventricular artery, the blood's moving opposite. The blood flow is opposite that of the vein, but along the atrioventricular groove, the artery and the vein are carrying blood in the same direction, so that's generally considered to be quite fascinating. The middle cardiac vein, the one of intermediate length, travels in the posterior interventricular groove from the apex of the heart. So we'll place that in its sulcus. One sec. So here we have it, the middle cardiac vein in the posterior interventricular sulcus. That's the back of the heart. This was the front. It's the great cardiac vein. Middle cardiac vein, posterior interventricular sulcus, and again coming up to the crux of the heart and then draining into the coronary sinus. This area here becoming very fat. And then finally the small cardiac vein, which is going to occupy the remaining part of the atrioventricular sulcus here, initially following the course of the right coronary artery. So here the small cardiac vein in the atrioventricular groove on the right, travelling around to the back of the heart. Actually, that carries blood in the same direction as the right coronary artery. So, I might have been led astray. So I apologise if I've said coronary vein at any point instead of cardiac vein, but hopefully that helps to explain things. So anterior view, anterior interventricular septum, great cardiac vein, to the back of the heart, draining into the coronary sinus. Posteriorly, middle cardiac vein in the posterior interventricular groove, draining into the coronary sinus, and returning anteriorly, small cardiac vein in the right part of the atrioventricular groove, also draining around into the coronary sinus. So in that way, you can, by identifying the sulci between the various chambers, we can very quickly and accurately name all the vessels in the coronary circulation. And together they form this kind of band around the top with a truss across the middle, rather like a glamorous thong for the heart. In this case, a potato. There you go. If we stick them all in together, you can see how the arteries and veins all travel in the various sulci and how they relate to one another and form this easily learnable pattern. Returning to our perhaps more lifelike model of the heart. So here, by identifying atrioventricular groove and interventricular groove, or sulcus, we can say anterior interventricular artery and commencement of great cardiac vein, circumflex coronary artery and continuation of great cardiac vein coming around to the coronary sinus. The right coronary artery, it's starting here in the atrioventricular groove, and yikes, coursing around the heart to the posterior interventricular groove and forming the posterior interventricular artery. Windy. Don't worry about this. The middle cardiac vein coming up the posterior interventricular groove to the coronary sinus, and the small cardiac vein will be accompanying the right coronary artery, also draining into the coronary sinus. So that's almost everything you need to know about the coronary circulation, the coronary arteries and the cardiac veins. There are some more details in your textbook. I wouldn't bother learning about the variations, just stick with the main picture and a right dominant coronary circulation. Remember to simplify in order to learn. Ka kite.